Hello everyone. Let's discuss about some of the myths surrounding breast cancer. In fact, this talk is kind of inspired by women whom I've met during my work in the hospital, who've asked me some questions. Sometimes their relatives asking some questions. Sometimes some men whom I scan and they've asked me certain questions. So, and of course, what I have observed during these years of investigating and treating breast cancer. The first thing is many women think that breast cancer, would always be associated with pain, and sadly that is the reason many of them don't come to us in time. So that's a myth. Breast cancer is often painless. A small proportion of them can be painful, but most of them are painless. So what's very important is, if there is a new lump in the breast, if it's especially kind of increasing in size, you should get to the doctor, even if it's not painful, even if it is painful. The other thing is, many women don't come to us because of the fear of breast cancer. What I'm trying to say is that if they were to have a lump, they think that this is definitely breast cancer. So even if that lump is giving them pain or any other concern, they still don't go because they're so scared of the diagnosis. But I would like to reassure you that 80% of the times when you come to us with a lump, it is actually not breast cancer. So rather than staying at home in fear that it may end up being breast cancer, it's best to come, get investigated and get the reassurance that it's not breast cancer. And if we are unlucky and it does end up being breast cancer, then we can at least treat you early, so that we can make sure that you get the best possible treatment and make sure hopefully that you live as long as anybody else that you know. Many women think that mammography is painful. In fact, they put off having mammography for years. Actually, it's a very comfortable test. Most of our women who have mammography have it done very comfortably. Of course, what happens during the procedure is that we compress your breasts between two plates, and sometimes it may give a little bit of discomfort, but it's really not painful. Now, however, if your main presenting symptom is pain, then you could have a chat with your doctor and see whether you could take some painkillers before the mammography test is actually done. But we do not routinely give any painkillers, and I must say that our women withstand the procedure very well. It's also important that you communicate when it's happening. If you think it's hurting, you have to let your mammographer or your mammography technician know that it is a bit painful, and they can kind of take your opinion into consideration as well in deciding how much compression to apply. So don't please be afraid of mammography. It is not overall a painful test at all. The next thing that I have seen very commonly is the lady herself or the family being very worried about biopsy. And the misconception that they have is that by putting a needle into a tumor, if it was a benign non-cancerous tumor, it would change into a cancerous one, or if it is already cancerous, putting a needle would spread it all over the body. That doesn't happen. If you can imagine, you are having lots of blood tests done all your life, and if a needle were to go in, how would that cause cancer? There are no cancer cells in the needle. So, it is pretty much the same thing. We are putting in a clean needle into the breast and taking some sample from there. So, really, that does not make the breast cancer spread all over the body. A few studies have happened to see whether there is any worry, in the sense that would taking the cancer cells out, would they cause other cancers within the breast, but there has been no evidence so far to suggest that a biopsy is in any way harmful to you. In fact, it's very important, because unless we biopsy, we don't know what it is. You may tell me that, oh, I would have taken the lump out anyway, so how does it matter whether it's cancer or not cancer? It matters a lot, because if it is not a cancer, your surgeon will operate in a different way. He will try and conserve as much normal breast as possible so that the breast stays symmetrical. Whereas if it is cancer, then the approach is different. He would want to take some extra tissue around to make sure that the whole cancer is out. He or she may want to operate on the armpit. So the entire approach to treatment changes. So please do not be worried about biopsies or needles in the breast. They are not going to harm you. They will only help you in deciding the treatment. Then when it comes to treatment, many women think that if they have breast cancer, then they lose their breast. This is a very important point that to keep in mind, is that breast cancer detected very early, if it is really small, we can just take the cancer out and basically keep the woman's breast, not put her through mastectomy or the operation where the breast is taken out, but instead the woman can keep her own breast. So that is why early detection is so important. And the other thing that many women think is that breast cancer is the end of life. It isn't. There are a number of women I personally know amongst my friends, amongst my patients, who are doing very well 20, 30, 40 years after the diagnosis. The key word here is early detection. If detected early, there is extraordinarily good treatment for breast cancer. We are very lucky in a way that there has been so much research in breast cancer that our treatment options 10, 15 years ago and our treatment options today, they are not really comparable. We have a lot more in our armamentarium to help you with. So please do go to the doctor sooner rather than later. The other thing I see is that many men think, or we all in general, women and men think that men don't get breast cancer. That's not true. Men can also get breast cancer. The chances of men having breast cancer is of course very small, but it does happen. We do treat breast cancer patients, male breast cancer patients. In fact, we also do mammography on them just like we would do on a female patient. So, any new lump, whether it's a female breast or a male breast, or any fluid coming from the nipple discharge as we say in a male breast or a female breast, do go to the doctor. Then there are a few other myths such as trauma causes cancer. It does not. Trauma to a part may draw your attention to that part of the breast, but it does not itself cause breast cancer. And there are women, when I do give awareness talks, some of them ask me whether a past history of abortion increases the risk of breast cancer. It doesn't. That doesn't increase the risk of breast cancer at all. And there are others who ask me whether shaving the armpit or applying antiperspirants in the armpit, whether that causes breast cancer. There has been no evidence, no scientific evidence of that causing breast cancer. So there are a number of myths around breast cancer. And the other myth, of course, I forgot this, is many think that particular types of undergarments can cause breast cancer. There is no evidence for that either. So the most important thing about breast cancer, to summarize, is to look for change in the breast. If it worries you, go to your doctor. If something changes and you're not certain it's worrying or not, still go to your doctor, get investigated, get treated early, and try not to believe in these myths, because really it doesn't help us. It just stops our treatment or just worries us. So all the best, and stay safe, and look after the health of your breasts. Thank you.